Every year, medical professionals diagnose more than 300,000 individuals worldwide with tumors of the brain and other parts of the central nervous system. Many more people are currently living with a brain tumor, frequently without even realizing it. Were you aware that there are more than 120 distinct types of brain tumors, and not all of them are malignant? In this video, I will guide you through some of the most startling early warning indicators that doctors actually utilize to suspect a brain tumor. These range from common symptoms like headaches or changes in vision to more subtle signs that most people tend to overlook. We will also discuss risk factors such as age, family history, previous exposure to head radiation, and specific genetic conditions that can quietly increase your risk. Please stay with me until the conclusion because understanding these early indicators can make a significant difference. This is not intended to cause fear. It is about awareness, taking early action, and providing real hope for you and your loved ones. A brain tumor is essentially a cluster of cells that begin growing in an abnormal manner within the brain. Imagine your brain as a bustling city where every cell has a specific job, a set of rules, and a schedule. A tumor is like a building that starts growing too rapidly without authorization, obstructing roads and exerting pressure on the rest of the city. That pressure is what triggers most symptoms. Brain tumors develop when certain cells stop responding to normal signals to stop growing. They divide repeatedly until they form a mass. Some tumors originate within the brain itself. These are known as primary brain tumors. Others migrate from a different part of the body, such as the lungs or breasts, and settle in the brain. These are secondary tumors, also referred to as metastases. Both primary and secondary tumors can be cancerous, malignant, or non-cancerous, benign. Even benign tumors can still lead to issues because the skull is a confined space, and any additional growth exerts pressure on vital areas. The symptoms you experience depend on the tumor's size and its location. For instance, a tumor near the vision center may impact eyesight, while one near the speech area may affect communication. As the tumor expands, it presses on nerves, slows down signals, and interferes with normal brain activity. Grasping these fundamentals helps you know what to monitor and what early steps to take. Before we proceed, ensure you watch this video until the very end because the final symptom is something most people have never even heard of, yet it can be one of the most crucial signs for protecting your health. If you care about your brain, your memory, and your long-term health, hit the like button, share this video with someone you love, and subscribe so you never miss life-saving information. Your awareness today could help you or even save someone close to you. So stay with me, stay focused, and let's explore this powerful health guide together. Persistent headaches. Persistent headaches can occasionally be a sign of a brain tumor, but they are significantly different from the typical headaches people experience due to stress, dehydration, lack of sleep, or excessive screen time. Standard headaches usually improve with rest, hydration, or basic over-the-counter medicine. Tumor-related headaches are often more intense, last longer, and do not resolve easily. Many individuals describe them as a sensation of deep pressure or a heavy ache originating from inside the head. They may worsen in the morning or during activities that increase intracranial pressure, such as coughing or bending over. The specific type of headache depends on the tumor's location. A tumor in the frontal lobe can cause pressure or tightness behind the forehead and may be accompanied by mood or concentration issues. A temporal lobe tumor might cause pain at the sides of the head and affect speech or memory. A cerebellum tumor often results in pain at the back of the head, sometimes alongside dizziness or balance problems. If the tumor obstructs fluid flow in the brain, pressure accumulates, and the headache becomes more severe and persistent. Biologically, these headaches occur because the brain is housed in a confined space. When a tumor grows, even a non-cancerous one, it presses on nerves, tissues, and blood vessels. This pressure triggers stronger pain signals and may stretch the meninges, the sensitive membranes covering the brain, causing further discomfort. These headaches can impact daily life, making reading, working, sleeping, or even talking more challenging and exhausting. However, it is vital to remember that most persistent headaches are not caused by brain tumors. Millions of people experience frequent headaches for harmless, treatable reasons. Therefore, please do not panic. This information is solely for building awareness. If someone has unusual, long-lasting headaches that keep returning, seeking an early checkup is wise. You are not alone. Awareness leads to early support and improved outcomes. Seizures are among the most alarming symptoms that can manifest when a brain tumor interferes with the brain's normal electrical activity. However, it is very important to understand that these seizures are not the same as the common sensations people often confuse them with, such as brief dizziness, lightheadedness, or a moment of weakness when standing up too quickly. Those everyday feelings usually pass rapidly and improve with rest. A seizure caused by abnormal electrical activity in the brain is quite different. It may involve body shaking, sudden stiffening, staring spells, confusion, or moments where the person becomes unaware of their surroundings. These episodes can be sudden, intense, and frightening for both the individual experiencing them and those around them. The way a seizure presents depends on the tumor's location. If the tumor is in the frontal lobe, seizures may cause jerking movements, sudden behavioral changes, or brief episodes of unresponsiveness. A tumor in the temporal lobe can cause strange sensations like déjà vu, unusual smells or tastes, waves of fear, or staring spells. Tumors in the parietal lobe may cause tingling, numbness, or electric shock sensations that spread before a seizure starts. If the tumor is in the occipital lobe, the person may see flashing lights, bright colors, or odd shapes. Tumors near the motor cortex can cause seizures involving only one side of the body, such as shaking of one arm or leg. Biologically, seizures occur because the brain communicates through tiny electrical signals. A tumor, even a slow-growing or non-cancerous one, can irritate nearby nerve cells. This irritation causes the cells to fire electrical signals in a rapid, uncontrolled manner, like sparks jumping in a wire. Swelling around the tumor or increased pressure inside the skull can make these electrical signals even more unstable, leading to a seizure. Seizures can profoundly affect daily life. A person may feel fatigued, confused, or emotional afterward. They may fear cooking alone, driving, going out in public, or being far from home. This can impact independence and confidence. But remember, not all seizures indicate a brain tumor. Many seizures occur due to fever, infections, low blood sugar, stress, or epilepsy. This video is intended to build awareness, not fear. If someone experiences unusual or repeated seizures, getting checked early is the safest step. You are not alone, and awareness gives you the power to protect your health. Vision changes are another significant symptom that can sometimes appear when a brain tumor affects the parts of the brain or nerves that control sight. However, these changes are usually very different from the common, harmless vision problems many people have, such as needing reading glasses with age, mild eye strain from screens, or temporary blurriness when tired. Normal vision problems often improve with rest, new glasses, or eye drops. Vision changes linked to a brain tumor are more unusual. They may include suddenly seeing double, losing vision on one side, bumping into objects on one side, seeing flashing lights, blurred or dim areas in your field of view, or feeling like parts of what you see are missing. These changes can develop slowly and may not improve with new glasses or a simple eye exam. The type of vision problem often depends on the tumor's location. If a tumor presses on the occipital lobe at the back of the brain, the primary visual processing center, it can cause blind spots, loss of peripheral vision, or trouble seeing shapes clearly. A tumor near the optic nerve can cause blurry vision, faded colors, or loss of vision in one eye. Tumors near the pituitary gland, which sits close to where the two optic nerves cross, may cause loss of side vision in both eyes, making it difficult to see cars, steps, or people next to you. Biologically, this happens because the brain and eyes work together like a camera and a computer. The eyes capture the image, but the brain processes it. When a tumor grows near the visual pathways, it can press on the nerves or brain tissue, blocking or confusing the signals. Swelling and increased pressure inside the skull can also push on these delicate structures, leading to blurred or double vision. These changes can affect daily life by making reading, driving, walking on stairs, recognizing faces, or even watching TV more difficult and frightening. But remember, most vision problems are not caused by brain tumors. Conditions like needing glasses, cataracts, dry eyes, or diabetes-related eye issues are much more common. This video is to help you understand warning signs, not to cause panic. If someone notices strange new vision changes that don't improve, it's wise to get checked. You are not alone, and early awareness gives you more power to protect your health. Nausea and vomiting are very common symptoms in everyday life and usually occur for simple reasons such as food poisoning, stomach infections, motion sickness, or eating something that doesn't agree with you. These types of nausea usually improve within hours or days with rest, fluids, or basic medicine. However, nausea and vomiting caused by a brain tumor are different because they originate in the brain, not the stomach. They often happen without any stomach-related cause and may occur early in the morning, come on suddenly, or repeat many times even when you haven't eaten anything unusual. Some people may also feel pressure in the head before the nausea begins, and vomiting can happen without warning. The exact symptom often depends on the tumor's location. Tumors in the cerebellum, the lower back part of the brain that controls balance, can cause nausea, dizziness, and vomiting. A tumor in the brain stem, which controls basic body functions, can disturb the centers responsible for nausea. Any tumor that increases pressure inside the skull can trigger the vomiting center in the brain, making a person feel sick even though their stomach is normal. Biologically, this happens because the brain is inside a closed space. When a tumor grows, pressure increases. This pressure irritates the areas of the brain that detect toxins, causing the brain to send signals that trigger vomiting. The brain reacts as if something harmful is present, even when it isn't. Pressure can also affect balance and nerves connected to the stomach, leading to constant nausea. These symptoms can affect everyday life by making eating, working, moving, or even sitting up difficult. But remember, most nausea and vomiting are not caused by brain tumors. More common causes include infections, migraines, acidity, or stress. This information is to build awareness, not fear. If nausea is unusual or persistent, getting checked early is always wise. You are not alone. Awareness keeps you safe. Weakness or numbness in the arms or legs can sometimes be a sign of a brain tumor. However, this type of weakness is very different from the usual tiredness people feel after a long day, heavy work, or sleeping in the wrong position. Normal weakness improves with rest, stretching, or better sleep, and numbness from sitting too long goes away when you move. Tumor-related weakness or numbness is more persistent, more noticeable, and often affects only one side of the body. A person may suddenly struggle to lift an arm, hold objects, climb stairs, or walk steadily. It may feel like one side of the body is heavier or not responding even without an injury. These symptoms depend on the tumor's location. Tumors in the frontal lobe, especially near the motor cortex, can cause weakness on the opposite side of the body. Tumors in the parietal lobe can lead to numbness, tingling, or loss of sensation. If the brainstem is affected, weakness may appear on both sides because the brainstem controls many nerves throughout the body. Biologically, this happens because the brain sends movement and sensation signals through nerves. When a tumor grows, even if it's non-cancerous, it can press on areas responsible for these signals. This pressure disrupts the electrical messages going to the muscles, causing weakness, or blocks sensory messages, causing numbness or tingling. Swelling around the tumor can increase pressure inside the skull, making symptoms worse. These problems can affect daily life, making walking, writing, holding items, or dressing difficult. It may also cause confusion, embarrassment, or fear because the symptoms seem sudden. However, most weakness or numbness is not caused by brain tumors. More common causes include nerve compression, vitamin deficiencies, diabetes, poor circulation, or even awkward sleeping positions. This information is for awareness, not fear. If someone has persistent or one-sided symptoms, getting checked early is always wise. You are not alone. Awareness brings safety and confidence. Memory problems can sometimes be a warning sign when a brain tumor affects the parts of the brain that control thinking and remembering, but they are very different from the normal forgetfulness most people feel in daily life. It is common to forget where you put your keys, miss an appointment, or struggle to remember a name when you are tired, stressed, or getting older. Those everyday slips usually get better with rest, better sleep, or less stress. But memory problems linked to a brain tumor are more persistent, more noticeable, and often start to disturb daily life. A person may forget recent conversations, ask the same question again and again, lose track of what they were doing, or struggle to follow simple steps in cooking, paying bills, or using a phone. They may feel mentally foggy, confused, or unable to organize their thoughts the way they used to. These problems often depend on where the tumor is. Tumors in the temporal lobe, especially near the hippocampus, the brain's memory center, can make it hard to form new memories. So new information is quickly forgotten. Tumors in the frontal lobe can affect focus, planning, and decision-making, which makes remembering and staying organized much harder. Tumors in the parietal lobe can disturb how the brain processes information, causing confusion that may feel like memory loss. Biologically, this happens because the brain works through tiny electrical signals between brain cells. When a tumor grows, it can press on these cells and pathways, slowing or blocking the signals needed to store and recall memories. Swelling and pressure inside the skull can also make thinking slower. These changes can affect work, relationships, and confidence. But remember, most memory problems are not caused by brain tumors. Stress, poor sleep, anxiety, aging, or vitamin lack are much more common reasons. This video is to guide you, not scare you. If memory changes are strange or persistent, getting checked early can bring peace of mind. You are not alone. Focal deficits are one of the most important and overlooked symptoms linked to brain tumors. A focal deficit means a very specific problem in one part of the body or one ability caused by an issue in a matching area of the brain. This is not the same as normal tiredness, clumsiness, or forgetfulness that improves with rest or sleep. Instead, a focal deficit is a clear local problem that does not go away easily. It may include sudden weakness in one arm or leg, trouble moving one side of the face, difficulty speaking clearly, losing vision on one side, or one hand feeling numb or clumsy while the other remains normal. The exact deficit depends on where the tumor is located. A tumor in the frontal lobe near the motor cortex can cause weakness on the opposite side of the body. A parietal lobe tumor may cause numbness, tingling, or difficulty sensing the position of a limb. A temporal lobe tumor can affect speech understanding and recognition of words or sounds. A tumor in the occipital lobe may cause partial vision loss or blank spots. Tumors in the brain stem can affect many functions at once, such as swallowing, balance, and facial movements. These symptoms occur because each part of the brain controls a specific function. When a tumor presses on that area or disrupts the communication pathways, messages between the brain and body become blocked or confused. This leads to problems in only the part of the body controlled by that affected area. Focal deficits can make daily tasks like walking, using one hand, talking, or reading difficult. However, not all focal deficits are caused by brain tumors. Stroke, nerve damage, vitamin deficiencies, and injuries can cause similar problems. This information is for awareness, not fear. If a new one-sided or persistent deficit appears, early medical help is important. You are not alone. Awareness gives you strength and protection. As we wrap up this video, remember that the purpose of this information is to protect you, not scare you. Today's symptoms, headaches, seizures, vision changes, weakness, memory issues, and focal deficits, can also happen for many simple non-cancer reasons. So please don't panic. Instead, use this knowledge as a guide to understand your body better. If you or someone you care about notices symptoms that are unusual, persistent, or getting worse over time, getting checked early can bring peace of mind and improve outcomes. Awareness is your strongest tool. You are not alone in this journey. We are here to support you, educate you, and help you make safe, confident decisions about your health. Thank you for watching and taking your health seriously. If this information has changed the way you think about your health and the signals your body sends, please subscribe to our channel and like this video. We are uncovering the vital health insights that are often overlooked. Let's cultivate a healthier future together. Our next guide to well-being will be opening soon.